Perfect. So just a little intro into today's talk. Today's talk is a collaboration with the Canadian Cancer Society. And so our topic today is on the link between alcohol and cancer. So our next slide, please. Great. So I'm very excited to introduce our speaker for today. We've got Brandon Purcell. And so Brandon is the Advocacy Manager for Prevention and Early Detection at the Canadian Cancer Society. For the last decade, he has worked in and around Canadian politics, first as a political staffer in Conservative governments federally and in Ontario, and later as a government relations advisor, specializing in not-for-profits and charities. So thank you so much, Brandon, for being here today with us, and I will pass it over to you for our presentation.
Fantastic. Thank you so much, Beneatha. I'm really happy to be here. I appreciate Wellspring for offering to host this webinar with the Canadian Cancer Society. I have to say right off the top that every organization that does webinars or events like this has to start having a video like that at the beginning, because apart from just being entertaining, it is informative. And I've honestly never seen anybody do that. And it is something I will be doing when I'm hosting down the road. So thank you for that inspiration.
Amazing. You're very welcome.
So I appreciate everyone for taking the time to come and join us today. I'm really happy to have the opportunity to speak to you. So like Vineetha said, my name is Brandon Purcell. I'm the Advocacy Manager for Prevention and Early Detection at the Canadian Cancer Society. So what that means is that a lot of the work that I do day to day is interacting with policymakers and decision makers in and around government, trying to improve healthcare options across the country and at the federal level, as far as screening is concerned. So trying to make changes to national screening programs, but also working a lot on prevention. So that work that links with alcohol, as we're talking about today, healthy eating, and sugar consumption. So with that aside, we'll dive right on in. So just to start off the bat with some of the things that we know. Canadians know about alcohol. So in 2023, about 77% of Canadian adults reported consuming alcoholic beverages within the previous year. And this is something that I like to keep in mind as I conduct my work on alcohol consumption, because I keep in mind that there's at least a quarter of the adult population in Canada who doesn't actually consume alcohol. And it's encouraging because it allows us to consider the ways in which our public spaces and social gatherings can actually be made more inclusive by reducing the emphasis on drinking alcohol. Sometimes it can seem like culturally drinking alcohol is sort of everywhere all the time. Similarly, we also know that about 2 out of 10 Canadians consume one alcoholic drink or more every single day. Now, despite this number perhaps seeming a bit small, it actually equates to over 7 million people in Canada. And I also think that's interesting to reflect upon, because for that same reason, the media makes alcohol seem like it is everywhere all the time. The role marketing plays to seem like everyone is consuming it, which we know isn't actually the case. I'll note that both of these numbers were identified before the pandemic. So since that time, close to about 20% of Canadians have said that their consumption of alcohol had increased during that time. So when you add the fact that a lot of Canadians are actually underestimating the amount that they drink, these numbers might actually be lower than they may actually be higher than they appear. So alcohol isn't known to increase the risk of all types of cancer, but it is classified as a group 1 carcinogen. And what that means is that it is a cancer-causing substance. It's in the same category as cigarettes. Alcohol is estimated to be one of the top 3 causes of cancer deaths worldwide. And evidence indicates that regular alcohol consumption of any type, be it wine, beer, or spirits, over time, and even at low levels, can actually increase the risk of developing at least 9 different cancers, which are shown in the images on this slide. Now, this is because the type of alcohol that is in alcoholic beverages is ethanol. And when that's consumed, our bodies convert and break down that ethanol into a substance called acetaldehyde. And those 2 substances are known to increase cancer risk in humans. Acetaldehyde has actually been shown to damage our DNA as well and stop our cells from being able to repair damage. Alcohol can also affect the levels of hormones like estrogen, which explains its ability to increase breast cancer risk. This anatomical figure stands out to me for a few reasons. First is because breast and colorectal cancers remain among the most commonly diagnosed cancers in Canada. And second, cancer cases among people under 50 have actually been on the rise in many parts of the world, including Canada. The cancers causing the most disease and death in this younger group include breast, stomach, and colorectal cancers. And research suggests that tobacco, alcohol, and obesity are key factors behind this increase. Lastly, the low survival cancers, including pancreas, esophagus, liver, and stomach, are all at risk because of or due to increased alcohol consumption. I do want to pause just for a brief moment here to acknowledge that about 4 in 10 cancer cases can be prevented through healthy living and policies that protect the health of people in Canada. And that's what we're talking about here today. However, that means that about 6 in 10 cancer cases can't actually be prevented. So under no circumstances do we think that anyone should be blamed, shamed, or stigmatized for receiving a cancer diagnosis. Our efforts are on prevention and are about creating a healthier environment that helps reduce cancer risk and preventable cancer cases, but recognizing that it's not going to be possible to eliminate all cancer cases through these measures. But this does beg a question. If people better understood the extent to which alcohol is a key modifiable risk factor for cancer and increasing cancers, particularly among the younger population, as well as some of the least easily treated cancers, might they be empowered to make different decisions for their health? So the intensity and duration of alcohol consumption impacts different cancer types in different ways. Cancer risk increases most among those consuming 4 or more alcoholic beverages in a day. Those people are considered high risk. And as well as those consuming between 1 and 4 alcoholic beverages a day. Those are considered moderate risk. But it's even a risk factor for those who are consuming no more than 1 alcoholic drink per day, which is categorized as low but not no risk. Data from the World Health Organization has actually suggested that people in Canada consume alcohol more on a per capita basis than the global average, and that's at 9 liters in Canada compared to 6 liters for the global average. We also know that alcohol consumption varies across a variety of factors, including sex, age, sexual orientation, socioeconomic status, indigeneity, and even various jurisdictions where you live. Back in 2015, an estimated 3,300 cancer cases diagnosed in Canada were due to alcohol consumption, which was about 2% of all cancer cases in that year. Prior to the pandemic, trends indicated that the number of people consuming alcohol at a moderate risk level were increasing, while the number of people abstaining or drinking alcohol at low risk levels was decreasing, with those consuming alcohol at high risk levels remaining pretty stable. Now, if this trend continues as it is, the number of cancer cases due to drinking alcohol was expected to triple, increasing from 3,300 back in 2015 to over 10,000 annually by the time we get to 2042. However, with these concerning numbers actually comes great opportunity. So if you take a look at the top green line here, what it shows is that everyone who currently consumes more than 1 alcoholic drink per day reduced the number of those who currently consume more than 1 alcoholic drink per day reduced the number of alcoholic beverages they consume by 1, we could prevent almost 4,800 cancer cases annually in 2042 and prevent over 68,000 cancer cases between now and that time. Furthermore, a 25% reduction in alcohol consumption prevalence among people in Canada between 2020 and 2032 could prevent at least 10,300 cancer cases and save the public healthcare system almost $1 billion in cancer management costs between 2032 and 2044. Now, I know I'm throwing a lot of numbers around right now, but what these statistics really demonstrate is the extent to which incremental changes in our collective behavior actually really has the potential to make a huge and positive impact both on our healthcare system and on our individual health. Now, despite there being over 30 years of research on the link between alcohol and cancer risk, public awareness actually remains relatively low on this. Data from CAREX Canada and the Canadian Cancer Society research project shows that today, over 40% of people in Canada actually still remain unaware that alcohol consumption can increase the risk of cancer. Now, this is important because we believe that people in Canada have a right to clear and accessible information about the health and safety of the products that they're buying, so that they can make informed decisions about their health. And I'll talk a bit more on this in a moment. Back in 2020, the Canadian Centre on Substance Use and Addiction began a new project to update Canada's low-risk alcohol drinking guidelines. So, recognizing new evidence on alcohol-related mortality and morbidity, as well as better understanding how alcohol contributes to social harms. Through this process, consultation participants ranked, quote, the impact of drinking alcohol on physical health, such as the link between alcohol and cancer, unquote, as the second highest priority for the updated guidelines after mental health. So this demonstrates the importance of relevance to the work that we're doing at the Canadian Cancer Society and in our broader cancer community. Despite some misrepresentations in the media, the new guidance on alcohol and health emphasizes that consuming less alcohol is better overall. Rather than specifying how much is safe or unsafe to consume, the new guidance looks at a continuum of risk. But even the high risk category on the continuum is actually significantly less than the previous low risk drinking guidelines, which continues to spur public reaction. This update is important because it reflects the best evidence available today, as well as unique perspectives of people living in Canada. It also reminds us that cancer is only 9 out of the over 200 health conditions and diseases that are actually related to alcohol consumption. When we broaden our scope a bit and look at health in general, alcohol is directly linked to over 800,000 emergency room and hospital visits every year and 17,000 deaths across Canada. Alcohol costs $19.7 billion a year in healthcare, lost productivity, criminal justice costs, and other direct costs. So despite popular belief, this is less money than the government makes from the sale of alcohol via taxes. So when you consider both the government revenue and the societal costs from alcohol, we actually have what we refer to as an alcohol deficit of $6.2 billion per year. And I recognize these stats are from 2020, 2021. That gap has unfortunately not shrunk since that time. Alarmingly, alcohol actually accounts for about 40% of the overall cost of substance use in Canada, which you can see here is more than the cost for opioids, cannabis, and cocaine use combined. Alcohol is also responsible for the most productive years of life lost, and that's alongside opioids as of 2020, as well as the most hospital stays and the most emergency department visits, and that's 19% of total alcohol costs are driven by health costs, and that includes the cost of physicians and prescription drugs. So with all of this research, cancer-specific and general health, it becomes quickly apparent that it's actually collectively costing us quite a bit, both economically and socially, to really continue maintaining our current relationship with alcohol as it stands. That's why back in 2023, the Canadian Cancer Society updated our own alcohol recommendation, which you can read here on this slide. The first part continues to emphasize the limiting of alcohol, as well as referring to Canada's guidance on alcohol and health as a helpful tool to make informed decisions on whether to drink and how much. Our recommendation invites Canadians, wherever they're at and without blame, shame, or stigmatization, to be mindful of their alcohol consumption and reduce the number of alcoholic beverages they consume whenever and in whichever way feels right for them. While the idea of reducing our alcohol consumption can be stressful, it's actually uplifting to know that about 60% of people in Canada already report drinking less than 2 alcoholic beverages a week, which falls within the low risk cancer category. So while there's a lot of work to be done, we're actually well on our way there now. Also, something we launched in 2023 was our alcohol policy position that states that our commitment to advancing stronger policies that reduce the alcohol consumption of people in Canada and increase their awareness about the risk of cancer related to alcohol consumption. To start, the Canadian Cancer Society is calling on the federal government to implement mandatory labels, including warnings with health and safety messaging on all alcoholic products sold in Canada. These labels, we believe, should include standard drink information, That's how much alcohol or how much of a product is considered a standard drink, as well as nutritional labeling, risk for cancer and other chronic diseases, as well as Canada's guidance on alcohol and health. We believe that provinces and territories have a responsibility to take a key role in this too, which is why we look to them to implement mandatory health and safety message requirements, as well, including the risk of developing cancer and other chronic diseases at any outlet where alcohol is sold, ideally at the point of sale. So diving a bit more into our alcohol warning label campaign, there was actually a first of its kind scientific study that took place in the Yukon back in 2017. That was led by Dr. Aaron Hoban and Dr. Tim Stockwell from Public Health Ontario and the Canadian Institute for Substance Research, respectively. That project tested the effectiveness of alcohol warning labels, and despite being disrupted by lobbying efforts from the alcohol industry, was able to successfully demonstrate that people remembered what the labels said, that they talked about the labels, and that consumers decided to drink less as both alcohol sales and consumption went down during this campaign period. It's because of studies like this that we know warning labels on alcohol products can help inform the public about the risks of consumption, including cancer risks. Alcohol labeling, along with continued education, will ensure that more Canadians can make informed decisions for their health. More recently, a Canadian Cancer Society funded study, also led by Dr. Aaron Hoban, found that cancer warning labels on alcoholic products appear to be associated with lower appeal, higher perceived health risks, and reduced consumption intentions, even when there's the presence of nutrient content claims such as 0 grams of sugar. This study contributes to the body of evidence that health warning labels can effectively inform the public about about alcohol consumption and cancer risk, and potentially reduce alcohol consumption in the wider population. So if you look at the image we have here, it's a mock-up of what our vision of both the warning labels as well as our other asks would look like on a beverage when it's sold in a store. So on the front, you see the warning label where it says warning, alcohol can cause cancer, in English and French. And on the back, you see, like any other food or beverage item that you would purchase, the nutritional information, which is still not mandated to be on alcoholic beverages. Furthermore, recent polling that we had the opportunity to conduct across Canada indicated that there's actually large public support for these measures. About 8 in 10 people in Canada support the implementation of these warning labels or some health messaging on alcoholic products as a strategy to raise awareness of health risks and cancer. 8 in 10 also supported including nutritional fact tables on alcoholic beverages, and actually 9 in 10 supported standard drink labeling to increase awareness about standard drink sizes. So if you haven't made the connection yet, there's actually many parallels between what our society is currently going through with alcohol and what was experienced 50 plus years ago with tobacco. Tobacco was widely encouraged before its health harms were more thoroughly understood throughout society, and this change has taken time but has taken place over decades. Our team sees this as an exciting challenge to drastically change population health for the better in matters related to cancer, but also across the 200 other public health conditions, including liver cirrhosis, cardiovascular disease, mental health, and other chronic health issues that come as a result of alcohol consumption. This is a big problem, and it requires more than one solution and tailored to many different audiences. But that's why we're grateful for those who are open-minded and willing to explore this conversation with us. So I'll take a step back and just talk a little bit about, apart from the advocacy work that that the Canadian Cancer Society does, but also a little bit about what we do to increase awareness. So we're committed to just increasing general public awareness about the link between alcohol and cancer as an important first step towards changing attitudes and behaviors. So right now, we do this through a variety of ways. On one of our more public-facing campaigns is Go Dry. It's going on right now, just wrapping up. Some of you might be familiar. It's an annual campaign where we challenge folks to cut out alcohol for the month of January, while also raising funds for the Canadian Cancer Society. And it's really encouraging to see that about 75% of Go Dry participants actually say that they'll drink less alcohol after participating in the campaign. And in 2024, almost 15,000 people participated in this event, and I'm reliably told that we're on track to beat that this year. So if in January 26 you're interested in joining that campaign, or if you want to learn more about it right now, you can go to godry.ca. I'll also mention, and now this isn't our project, but it's something that's really fascinating, and this is something we'll mention soon during our Go Dry campaign, and it's the No Alcohol web app. It's a really interesting tool that was developed in the University of Victoria out in British Columbia. And what it does is it has you go to a web portal, noalcohol.ca, and you can enter in some of your personal health information totally anonymously, of course, and your alcohol consumption habits. And the app is a calculator that will then take that information and spit out a variety of health impacts that you can expect to see as a result of that consumption. But what it also does is show how those small changes in just weekly or daily consumption can make dramatic differences in your risk factors for developing cancer and other chronic illnesses. So if you have a chance, I would highly recommend checking that out. Again, that's noalcohol.ca. Jumping back just a bit to our Go Dry challenge, just want to talk a little bit about the results in terms of the positive health impacts that we see among folks who take part. Like I said, among those who've taken part, we see that about 3/4 of respondents pledge to reduce their alcohol intake going forward after completing the challenge, and that about 25% want to become more physically active, and another 20% actually change their dietary habits. So it's really about compounding those positive health changes and those positive decisions that you can make to better your health going forward. So just to wrap up a bit on sort of my speaking portion, the Canadian Cancer Society is committed to our role on this issue and to work as a champion for people living with and beyond cancer. That's why we all do what we do. But nothing's going to be solved by one person or one organization. So if you wanted to see more information or were looking for opportunities to take action, we'd advise you to visit cancer.ca, particularly our pages on alcohol policy, limiting alcohol, and sobering facts about alcohol and cancer risk. You can join us next January for the next Go Dry campaign. You can read more about Canada's guidance on alcohol and health for broader implications of alcohol consumption and overall health. You could also join an organization also based at the University of Victoria called the Canadian Alcohol Policy Evaluation Community of Practice. Bit of a mouthful there, but it's a policy community that helps to build and sustains long-term connections, collaborations, and foreign professional development between individuals and a variety of government and non-government sectors, with a shared goal of promoting healthy public policy around alcohol. And lastly, you can just get in touch with me, Brandon. So if you want, you can just reach out at brandon.purcell@cancer.ca. If you just want to connect, talk a little bit about this or other issues that are important to you, or if you'd like to be added to the Canadian Cancer Society's list for periodic email updates on our alcohol advocacy policy. So with that, I'll thank everyone for their time and their attention, and I want to thank Wellspring again for the opportunity to come and have this discussion with you. And I'd be more than happy to open things up to some questions and discussion.